all the time, because watch this. What is a PE? No shit, Sherlock. What is a PE? Where? Your nurses, you don't use the word lungs. I heard it.
Pulmonary embolism.
Ari gets it. Stay with me. What is a CVA? No shit, Sherlock. What is a CVA? What? You're not a lay person. What is, you better shout if you're talking to me because I can't hear you. Carotid what, nurse? There go my baby. Okay. What is this? Stay with us. Stay with us.
The heart, I guess.
Coronary artery.
Man, y'all suck in anatomy and physiology. Jesus. Woo. Watch this. What is this? Now, I need you to stay with me because y'all on some bullshit today. Listen, babies. All the same. All the same. All of these are arteries. All of these are clots. This man had a stroke last year. PE, what do we know about PEs? 100% of them are DVT. Makes sense, he's got both, duh, right? So he has PE DVT now on CAT scan. They're all clots. So he clots real easily. So his PTPTT is too low. He needs what? An anticoagulant to bring the PT and PTT high. You feeling me yet? So Coumadin will bring him up in the PT. Heparin, which is what we're initially thinking, would bring him up in the PTT. We do something called bridge therapy, where we start the PE DVT out on heparin, and then after the heparin is on for a little while and therapeutic, we add Coumadin at the same time the heparin's going, and we do not turn the heparin off until the Coumadin is therapeutic, at which point you're going home on Coumadin. Is it making sense? Yes. Again, anticoagulants are geared towards raising the PT and the PTT. So you don't clot like crazy, right? Because it don't take you no time. I look around, you're clotting every minute. You see? Okay? Bleeders take too much time. The last thing they need is heparin and Coumadin. Agree? Yes. Is it starting to make sense? Yes. Okay, now if all of us went to Hillcrest, our PTT would be 30, our PT would be about 12. These patients I just gave you have some abnormal clotting mechanisms. Last component, write it down. All of these patients also, these, not the bleeders, not the bleeders. All of these patients have a high D-dimer. put that on the page number 9 by PTPTT. Anybody with a clot, like these people, PECVA, MI, and DVT, they will have a high D-dimer. They like D-dimer lately on your test. They like the D-dimer lately on your test. Okay? All right now, so you have your clots. Those are gonna be patients with PTTs and PT, too low. And then you have your bleeders, and their PTTs too high. All right, that's pretty good. I think some of you came along with me at the end. Now, what I did is I put a cheat sheet on here. It also helps me even at work with all the damn heparin drips your ass is gonna get. Let me just be real clear. Every single person in here is gonna get a heparin drip, okay? We'll just keep it real. So all the heparin drips you get, if you look at what I wrote at the end, shut off if PTT greater than 75 seconds. Now, the good news is because nurses don't know what the fuck they're doing with the PTs, PTTs, and they don't understand what I just taught you, they have gotten to the point where they do something called a nomogram, and you ain't even got to think no more, except when the damn epic goes down. Then your little ass better know how to think. So that's why I teach you all the highest level, because epic goes down quite a bit at the hospital. So you better understand when you get that PTT reading back from the lab, in your mind, you don't fucking need an epic to tell your ass to shut the stuff off. You know good and damn well if it's over 75, this shit is ridiculous. Okay? I put that cheat sheet there for you because this 75 ain't no joke. I done seen 90s, I done seen all kind of shit. Higher than 75, start getting nervous. If it's Coumadin, we don't do a lot with PTs. I know it sounds like we should, but we don't. That's just real talk, but your test will do it anyway. So on your test, look when you stop it. When do you stop it? It's on there. 30 for that one. So PTT 75 seconds, PT 30 seconds. That's when you stop it, 30 seconds. Stop the damn Coumadin. We don't do much with that in real talk, real world, and I like to give you both. So what do we follow with Coumadin in real world? INR. So watch this. INR. How many fingers I got up? That's what the fuck it better be. All right? That's it. I mean, don't make life hard. Okay, so what I'm saying to you, if you remember Algebra 101, if it's 2.5, that round up to a 3, so we good. 3.4, that's cool, we still 3, we good. 3.5, I ain't comfortable with that bullshit, watch them. 4, fuck it, stop it. You still good? Now, we had a 6. This is how ignorant that shit went down. This was at the VA. This was my X factor. He didn't do it, he was smart that way. So, he didn't do it, but his LPN did. So that's why RN, you are still responsible. Yes, LPN is very independent and very brilliant. Mine trained me, and she used to be in my class as my student, and she was my preceptor. So don't get it twisted. They can teach you a lot, and she did more than anybody in the unit. So Jackie taught me everything in that unit. But this particular day, this LPN gets this patient's blood result back, INR of 6.1. Now, the patient's there because they just don't feel good, and they had bruising, so, you know, like, okay. They get bruising though, so she kind of blew that off. And before she get the result back, she told him he could go home. There's only one problem with that. We over there on Wade Park in the city, in the hood. This brother owned a bus. So he taking 2 or 3 buses back home because he a veteran, is what he do. She gets this 6.1. Which bus is this motherfucker on? He ain't no cell phone. He couldn't afford one. So now we gotta wait till what? He gets home, pray he makes it to his house, send somebody to get his ass and admit him. Do not do stupid on steroids, please, Jesus. These labs don't take that long. Something as serious as an INR, you just at the hospital with it, you just kind of want to tell them to be patient. Let's see what it is first. Okay, this is too much. He out there with a 6.1, one bump, one fall, one anything, and he gonna bleed to death. He has like nothing to clot. Does that help a little bit? Because again, people, it's supposed to be 3. 2.5 is fine, 3 is great, 3.4 is lovely, 3.5 I'm watching, 4 you're fucked up. No 6s. That's crazy. My God. Okay, so here we go. Specific